Hi everyone, in this video we're going to talk about mental health problems of the people living with HIV in Asian American and Pacific Islanders or AAPI communities. We will also share some of our findings of the factors that are influential and discuss our recommendations for interventions on individual and community level. Let's start from the fact that mental health problems has always been a great threat to the people living with HIV. The worldwide prevalence of depression in HIV patients, according to a meta-analysis study, was 31%. This data was shockingly high compared to a 3.4% average in the general population. According to the studies, enacted social stigmas have been negatively influencing patients' access to health, consequently further threatening this marginalized community. This phenomena is even more serious when it applies to Asian communities in North America. We have identified several specific factors that are influential in Asian communities, including multiple culture stigmas, language barriers, and their psychological experience of living with HIV. First, let's talk about cultural factors and their influences.
What is the major HIV prevention challenge that affects AAPI specifically? Interestingly, it is the cultural context. Some AAPIs may avoid seeking testing, counseling, or even treatment due to several underlying cultural factors. To understand the unique challenges that HIV-positive members of the AAPI communities face, we must first dissect the cultural context and understand the intersectionality. Question time. Can you suggest some cultural factors that bring challenges in HIV prevention, particularly in AAPI communities? If you suggested these factors, you're right. Now, let us look at each of these factors in detail in order to understand the intersectionality and the complexity of the issue. LGBTQ people in AAPI communities face unique social pressures. Their sexual identities deviate from the values and norms of both American culture and their ancestral culture. Since traditional Asian culture strongly values heterosexuality, they may feel rejected by their family and their cultural community. At the same time, they have to face LGBTQ communities that consist predominantly of white people. The experience of rejection may contribute to poorer mental health. Homophobia has also been found to be linked with HIV risk behaviors in gay men of color. Stigma may also extend to their parents, who may be viewed as having failed at instilling traditional gender roles. Moreover, researchers identified that misinformation about HIV and otherization of people who are HIV positive were significant factors affecting HIV prevention efforts in Chamorro and Tongan communities in Southern California. Respondents in the study believed that gay men and women were more at risk of HIV in comparison to their heterosexual counterparts, since gay men and women were wrongly assumed polyamorous. In most AAPI cultures, sex is a taboo subject. Therefore, sexual communication is limited in AAPI communities. Researchers pointed out that cultural schemata about sex and HIV knowledge and beliefs influence gender norms. A study of the commonalities in sexual norms among South Asian immigrants in the United States revealed that traditional sexual norms in the community prevent women from engaging in discussion about sexual health and knowledge. Women who were married might mistakenly assume that they were protected against HIV because they assumed that marriage equated monogamy. The levels of acculturation among adolescents might also influence the communication about sex between parents and children. Due to cultural beliefs, some Asian parents think that talking about sex with children encourages early sexual behaviors. Parents avoiding sexual communication with adolescents were often found to be unaware of their child's sexual experiences. These family-level factors were identified as a barrier to recruiting Chinese American adolescents for cross-sectional HIV studies. Moreover, Taiwanese immigrants who were acculturated reported higher levels of sexual activity and higher numbers of sexual partners. More importantly, acculturation might increase sexual risk behaviors among AAPI youths. You may know this famous line by Mushu from the Disney movie Mulan.
That's it. Dishonor. Dishonor on your whole family. Make a note of this. Dishonor on you. Dishonor on your cow.
Stop! For many people in AAPI communities, they face the fear of bringing shame to their families because of the collective culture. It is common for HIV-positive individuals wanting to shield family members from feeling humiliated or burdened. This creates another barrier to talking about HIV within AAPI communities. Because of this collective culture, we need a community response to reducing stigma rather than an individual one.
Cecilia talked about where the stigma comes from in Asian culture and how it's originated. And I'll be using simple examples to explain to you what the experiences are for Asian people who live with HIV and AIDS under these stigmatizations. It's important for us to know what their life looks like to be a person who are HIV positive. First of all, what does it mean to be HIV positive? We have 3 options here. Take a look, and I really hope none of you choose B. So being HIV positive means that you have taken at least 2 tests, including 1 follow-up test to confirm the positive result that you have infected with the HIV virus. However, it doesn't mean that you have AIDS. When we're talking about HIV and AIDS, HIV is the virus itself and AIDS is the most advanced stage of HIV disease. HIV can lead to AIDS if a person didn't get treatment or take care of their health. But if a person with HIV takes their medicine as prescribed, and they may stay healthy for many years, and may never be diagnosed with AIDS. Here is data showing the estimated incidence and prevalence of Asians with HIV in the United States in 2018. Asians, who make up 6% of the population, accounted for about 2% of HIV diagnoses in 2018 in the United States and their areas. And most new HIV diagnoses are among Asian gay and bisexual men. Now that we know the basics about HIV and AIDS, I'll take you to immerse in someone's life who are tested HIV positive. Let's name this person X, and I'll refer to X as they or them. And we will experience what X is experiencing. So in this way, we know what their everyday life looks like, and therefore we know how to support them mentally as their families, friends, or community members with their life living under a stigma-free society. So X just got their HIV test result back yesterday, and it's confirmed positive. Today is the day they go to their parents' house for the weekly gathering. X decided to call for sick and skip this week's dinner because they don't know how to face their parents. X is scared. Instead, X decides to go to a pharmacy and ask for professional advice. Pharmacists were nice at first. However, as soon as they know X is a HIV positive person, something's different. They became reluctant to talk to X, and X immediately felt less empathized. X decided to go home instead of getting help from the pharmacist. Weeks later, X has neither told any families or friends about the situation nor gone for medical advice. Stress level is building up, and X feels helpless now. All of these are possible situations that people live with HIV and AIDS might face in society with stigmatization, when being afraid of isolated from families and friends because of fear of infection, dishonor, and shame. Family members might disown them. For many, this comes as the first blow to the ability of HIV-positive person to live a normal life. This kind of treatment makes it clear to them that they deserve to be excluded and avoided. Stigma and discrimination from healthcare providers that give treatments with less empathy towards people who live with HIV and AIDS can also be traumatized and carry out psychological consequences. I wish all of us know that AIDS is not killing people anymore. What's killing us is the stigma. The way we scout upon kills us.
Now, how do AAPI communities experience HIV in comparison to other ethnic groups? Everybody has different experiences with HIV, whether you have it or not, or you know somebody that lives with HIV, or even no experience with HIV whatsoever. However, I want you to think about why it's important to notice how different ethnic groups and their circumstances can affect their experience with HIV. Personally, I think it's important to consider the differences between ethnic groups in their experience with HIV because it emphasizes the need to give attention to a specific community, which, in this particular case, is the AAPI community. Additionally, it can also shed light on aspects of the AAPI community that we need to focus our HIV prevention efforts towards. For instance, we know that in the years 1999 to 2003, the AAPI community has shown a significantly larger growth rate of AIDS cases when compared to other ethnic groups in the US. While this isn't too recent, this still indicates that HIV is a problem within the AAPI community that needs to be addressed in whatever way possible. A factor that affects HIV prevention is the large immigration rate of AAPIs into North America. According to the 2016 Canadian census, around 62% of Canada's immigrants that year had come from Asian countries. Due to this high immigration rate, AAPI immigrants would likely have a harder time getting an HIV diagnosis, getting the medical care they need, and other HIV services when compared to Caucasian individuals and other more common ethnicities in Canada because of language barriers or a general lack of knowledge of how the Canadian health system works. Another factor that affects HIV prevention in AAPI communities is the stigmatization of sex and things sex-related. Anecdotal studies have shown that people in Asian communities will often not seek help for HIV, especially if the helper would be someone of the same ethnicity. Because AAPI communities are often quite tight-knit communities, these people don't want the fact that they needed HIV help to get out, which might lead to them being looked down upon. Do you have any ideas to help AAPI individuals and communities? One suggestion that I came up with is to simply encourage AAPI individuals to seek help if it's needed, and that it's okay to need it. As Cecilia previously mentioned, AAPI communities are generally collectivistic. They don't want to impose their issues onto others, and so they tend to keep their problems to themselves. Ultimately, we have to change this way of thinking. Another suggestion would be to encourage AAPI individuals to get regularly tested for STIs if they're sexually active. Knowing whether you have HIV is a crucial step for HIV prevention. Finally, we can start campaigns across Canada to normalize HIV alongside ongoing campaigns that normalize differing sexualities. These HIV campaigns would specifically be from AAPIs to AAPIs and encourage more difficult conversations in non-judgmental environments. Reducing the stigmas that are continuously circulating within AAPI communities will greatly help with HIV prevention.
And that is our presentation for today. We really hope that we had helped you to gain more understanding of Asian people living with HIV and the stigma they're facing. Thank you, and goodbye.